Hello everybody, it's February and we just had Valentine's Day and we want to hope everybody had a great Valentine's Day. Today we want to talk about your heart and inflammation, which is a problem with your heart and leads to plaque buildup and leads to heart disease. And most people don't realize that inflammation is the main problem with heart disease. They think cholesterol is the main problem. But what happens with your heart is you have the blood pumping through. It goes out to the arteries, and if there's inflammation in your arterial walls, then the cholesterol is laid down as like a bandage to repair damage done in your arteries by inflammation. So the cholesterol is not the main problem, it's the inflammation. And if this inflammation continues, then there continues to be layers laid down of the cholesterol until eventually it can harden the artery, it can shorten the area that the blood has to pass through, make it smaller, or it can throw a clot, which can then cause stroke, pulmonary embolisms, can cause problems with your lungs. All kinds of problems happen because of inflammation over time. So what we try to encourage people to do is not just get your cholesterol checked. If you haven't had the levels of inflammation checked for your heart, there are ways we can do that now in the office. Very simple tests that will help to tell. We can tell the stress on your heart, we can tell the levels of inflammation in your body, and we can tell the amount of clogging in your arteries now. So these are very simple tests you can do. They're not generally done in a medical checkup. They'll test your cholesterol, but very rarely will they check for levels of inflammation in your arteries, or if you have clogged arteries, then that has to be checked medically with a cath. But now we have new ways to check, very easy, non-invasive things to do. So we encourage you to ask about those when you come in the office. The first thing we have is the Smart Pulse test, which just sits on your finger, and it will tell us levels of stress in your body and in your heart, and it will tell us levels of buildup in your arteries, which is very important. Then we also have a little pinprick test we do now to take 1 drop of blood, and we can tell levels of inflammation in your body and in your arteries. So these are very easy tests you can do. We also have them discounted through February. If you make your appointment in February, even if you come in March, as long as you make your appointment in February, you'll get 15% off of the pinprick test where you take the drop of blood, or you can get your Smart Pulse test done for half price. So we'd love to have you get those levels checked during Heart Health Month. These are tests you won't normally get done in your medical doctor's office, so we encourage you to call and do that at 614-436-3870. Thank you. Have a great day.